Your doctor says your back pain is just part of getting older and hands you a prescription for painkillers. But what if I told you that's not the whole truth? While it's true that low back pain is one of the major disabling health conditions among older adults, age 60 years or older, the idea that you just have to live with it is completely wrong. There are specific reasons why your back hurts after 60, and there are proven ways to fix it. Without surgery, without dangerous medications, and without accepting that pain is your new normal. In the next few minutes, I'm going to show you exactly what's happening to your spine and the step-by-step solution that's helped thousands of seniors reclaim their pain-free lives. Let's start with the brutal truth about what aging does to your spine. Your back pain after 60 isn't random. It's the result of decades of changes that have been building up in your body. The most common culprit is something called spinal stenosis, where this condition narrows the amount of space within the spine. This can squeeze the nerves that travel through the spine. But spinal stenosis is just one piece of the puzzle. Your spinal discs, those cushions between your vertebrae, have been slowly wearing down for years. Degenerative disc disease isn't a disease. It's the name for what happens when your spinal discs begin to wear down, leading to neck and back pain. Think of your discs like the shock absorbers on your car. After 60 years of use, they've lost their bounce, become thinner, and can't cushion your spine the way they used to. Meanwhile, the joints in your spine, called facet joints, have developed arthritis. The cartilage that once allowed smooth movement has worn away, leaving bone rubbing against bone. The ligaments that hold your vertebrae together have thickened and become less flexible. All of these changes happen gradually, which is why you might not have noticed them until suddenly, every movement hurts. Lumbar spinal stenosis is a common condition in elderly patients, and also one of the most common reasons to perform spinal surgery at an advanced age. But here's what your doctor might not be telling you. Surgery isn't always necessary, and there are non-surgical approaches that can be incredibly effective. Your back pain isn't just about structural changes, it's also about how you've been living. After decades of sitting too much, moving too little, and using your body in ways it wasn't designed for, you've created the perfect storm for chronic back pain. The biggest culprit is what I call modern living syndrome. You spend hours hunched over computers, slouched in chairs, and bent forward looking at phones. This forward head posture puts enormous strain on your entire spine. Your head weighs about 10 to 12 pounds, but for every inch it moves forward from its natural position, it effectively doubles the load on your neck and upper back muscles. Then there's the sitting epidemic. Most people spend 8 to 12 hours a day sitting, and sitting is devastating for your spine. When you sit, the pressure on your discs increases by 40% compared to standing. Sit with poor posture, which most people do, and that pressure can increase by 85%. After years of this, your hip flexors become tight, your glutes become weak, and your spine loses its natural curves. Muscle imbalances are another hidden factor. Your deep core muscles, the ones that actually support your spine, have become weak from disuse. Meanwhile, your surface muscles are overworked and constantly tense, trying to compensate. It's like having a foundation that's crumbling while the walls work overtime to keep the house standing. Sleep position matters too. If you sleep on your stomach, you're forcing your spine into an unnatural arch all night long. If you sleep on your side without proper pillow support, your spine curves sideways for 7 to 8 hours. These seemingly small factors add up to big problems over time. The good news? Every single one of these factors is completely within your control to change. Here's what most people don't understand about back pain. The solution isn't rest. It's the right kind of movement. If you have degenerative disc disease or back pain related to arthritis, the best thing you can do is to find movements that help to loosen up your back muscles and improve your mobility. Your spine is designed to move in 6 directions: forward, backward, side to side, and rotation in both directions. When you stop moving in any of these directions, you lose the ability to move in that direction. It's the classic use it or lose it principle. The magic happens when you start moving your spine through its full range of motion again. A gentle, regular exercise routine can help you manage degenerative disc disease symptoms, including back pain. But this isn't about aggressive stretching or high-impact exercise. It's about gentle, controlled movements that restore mobility and strength where you need it most. These are the core 4 movements for back pain relief. Movement 1, spinal wave cat-cow. Start on your hands and knees. Slowly arch your back like a cow stretching, then round it like an angry cat. This movement restores flexibility to every segment of your spine and gets synovial fluid moving in your joints. Movement 2, gentle spinal rotation. Sit in a chair with your feet flat on the floor. Place your hands behind your head and slowly rotate your upper body left and right. This restores the rotational movement that sitting steals from your spine. Movement 3, hip flexor release. Step 1 foot forward into a lunge position. Gently push your hips forward while keeping your back straight. This counters the tightness that comes from too much sitting. Movement 4, glute activation. Lie on your back with knees bent. Squeeze your glutes and lift your hips off the ground. This wakes up the muscles that support your lower back and often becomes sleepy from sitting. Start with just 5 to 10 repetitions of each movement, twice daily. Your back has been in pain for months or years. Don't expect it to change overnight. But within days, you should notice less stiffness in the morning and easier movement throughout the day. Movement is the first step, but strength is what makes the changes permanent. Not gym-style strength training with heavy weights, that can actually make back pain worse. I'm talking about functional strength that directly supports your spine. Your core isn't just your abs. It's a complex system of muscles that includes your diaphragm, pelvic floor, deep abdominal muscles, and the small muscles that run along your spine. When this system works properly, it creates internal pressure that supports your spine like a natural back brace. The gentle strength protocol. Exercise 1, dead bug. Lie on your back with knees bent at 90 degrees. Slowly extend one arm overhead while extending the opposite leg. This teaches your core to stabilize while your limbs move, exactly what it needs to do all day long. Exercise 2, modified plank. Start on your knees and forearms. Hold this position while breathing normally. This builds endurance in your deep core muscles without straining your back. Exercise 3, wall sit. Lean your back against a wall and slide down until your thighs are parallel to the floor. This strengthens your legs while teaching your spine to maintain proper alignment. Exercise 4, bird dog. On hands and knees, extend one arm forward and the opposite leg back. This challenges your balance while strengthening the muscles that stabilize your spine. The key is starting slowly and building gradually. Begin with holding each position for 10 to 15 seconds, working up to 30 to 60 seconds over several weeks. Regular movement not only alleviates pain, but also boosts energy and improves daily functioning. Good posture isn't about pulling your shoulders back and sucking in your stomach. That's actually terrible advice that creates more tension. Real postural health is about alignment that allows your muscles to work efficiently with minimal effort. The 30-second posture reset. Stand against a wall with your head, upper back, and butt touching the wall. Step forward 6 inches while maintaining this alignment. Take a deep breath and let your shoulders relax. Walk forward with this new posture awareness. This simple reset can be done multiple times throughout the day to remind your body of proper alignment. Set a timer on your phone to do this every hour if you spend a lot of time sitting. The workspace setup that saves your spine. Monitor at eye level so you're not looking down. Feet flat on the floor with knees at 90 degrees. Back fully supported by your chair. Keyboard and mouse close enough that you're not reaching forward. But even the perfect setup won't save you if you sit for hours without moving. Set a timer to get up and move for 2 to 3 minutes every 30 minutes. This isn't just good advice. It's essential for spinal health. The sleep position solution. Side sleepers. Put a pillow between your knees to keep your spine aligned. Back sleepers. Place a pillow under your knees to reduce pressure on your lower back. Stomach sleeping? Just don't. If you must, put a thin pillow under your pelvis. When your back is screaming, you need relief now. Here's a protocol that can significantly reduce pain within 48 hours. Hour 1, 2. Ice and rest. Apply ice for 15 minutes every 2 hours for the first day. Ice reduces inflammation and numbs pain. Lie on your back with your knees supported by pillows. Hour 6, 12. Gentle movement. Start with very gentle movement, just the spinal wave motion from hands and knees. Movement prevents your muscles from stiffening up. Day 2, 3, heat and mobility. Switch to heat after the first day. Heat increases blood flow and relaxes muscles. Add in gentle walking and basic stretches. Day 4, 7, progressive loading. Gradually increase your activity level. Add the strength exercises we discussed, starting with very short holds and few repetitions. The anti-inflammatory protocol. Drink plenty of water to keep your discs hydrated. Eat anti-inflammatory foods like fatty fish, leafy greens, and berries. Avoid processed foods, excess sugar, and refined carbs that increase inflammation. Consider natural anti-inflammatories like turmeric, ginger, or omega-3 supplements. Remember, this protocol is for general back pain. If you have severe pain, numbness in your legs, or loss of bowel bladder control, see a doctor immediately. Quick fixes are great for immediate relief, but the real goal is preventing future episodes. The research is clear. Exercise and physical therapy play crucial roles in treating disc disease and managing pain. This isn't about becoming a fitness fanatic. It's about making small, consistent changes that add up to dramatic improvements. Your daily back health routine. 15 minutes total. Morning, 5 minutes of gentle spinal movement to wake up your spine. Midday, posture reset and 2-minute movement break. Evening, 10 minutes of strengthening and relaxation exercises. Weekly goals, 3 days of strength exercises, 20 to 30 minutes each. 2 to 3 walks of 20 to 30 minutes. Daily spinal mobility work, 5 to 10 minutes. Monthly progress tracking. How far can you walk without pain? Can you sit longer without discomfort? How's your sleep quality? What activities are you able to do again? The key is consistency over intensity. Mistake number 1, complete rest. Bed rest for more than 1-2 days actually makes back pain worse. Your muscles weaken, your joints stiffen, and you lose the conditioning you need for daily activities. Mistake number 2, pushing through severe pain. There's a difference between mild discomfort and sharp pain. Sharp pain is your body's warning system. Listen to it. Mistake number 3, relying only on passive treatments. Massage, chiropractic adjustments, and physical therapy can be helpful, but they won't fix the underlying strength and mobility issues. You have to do the work yourself. Mistake number 4, all or nothing thinking. You don't need to be perfect. Missing a day of exercise doesn't undo your progress. Just get back to your routine the next day. Mistake number 5, ignoring your environment. Your mattress, your chair, your car seat. All of these affect your spine. Small improvements in your environment can make big differences in your pain levels. Here's exactly what to do starting right now. Today, do the 4 gentle movements I showed you. Spinal wave, rotation, hip flexor release, and glute activation. Do them slowly and gently, just 5 repetitions each. This week, add the posture reset to your daily routine. Set reminders on your phone to do it every hour while you're awake. This month, begin the strength exercises, starting with very short holds and building gradually. Focus on consistency over intensity. Ongoing, make movement a non-negotiable part of your day. Your back pain didn't develop overnight, and it won't disappear overnight. But with consistent effort, most people see significant improvement within 4 to 6 weeks. Remember, you have more control over your back pain than you think. While structural changes are part of aging, pain isn't inevitable. The solution is movement, strength, and consistency. Your back has been carrying you for 60+ years. Now it's time to carry it back to health.